My name is Frédéric Fabry, and I'm the director of the Baylor School of Environment. And I welcome you all to this panel discussion on impacts of COVID on society, environment, and our future. When COVID struck and our travels were limited to neighborhood walks and in the park, I was struck by how clear the skies looked and how much further I could see distant mountains than before. And I have also been intrigued by the similarities and differences between the crisis, COVID, and environmental degradation triggered. And I must admit, and how we are responding to them. And to be honest, I'm a bit jealous at how one of these two crises was met with aplomb and dedication. But our reactions to COVID and the opportunities they created or curtailed may be felt for a very long time, and on the environment and on society. And there are some interesting interactions between those, and this is actually the raison d'être for this panel. So to get this discussion started and to moderate this panel, I invite you to the mic, Dr. Tim Evans. He's the inaugural director and associate dean of the School of Population and Global Health in the Faculty of Medicine and Health Sciences, as well as the associate vice principal in matters of global policy and innovation. Tim, you need to lengthen your name.
Well, thank you very much, Professor Fabry, and I have an easy job today, which is simply to introduce a star-studded panel that are going to illuminate you on this fascinating topic. So we're going to cut right to the chase so that you can begin. We've got a set of 4 presentations, and that will be followed by, first of all, a test to make sure you're all listening. So get ready. But secondly, question and answer, and so we'll look forward to that as well. So I'm going to begin with Professor Kevin Manaugh, who's an associate professor in geography and also jointly appointed at the Baylor School. Kevin, please.
Great, thanks a lot, Dr. Evans. And yeah, I'm very happy to be here. Is this, yes, okay, great. So yeah, I'm Kevin Manaugh. I'm in the Department of Geography and Baylor School of Environment. And I'm gonna talk a little bit, sort of what Dr. Fabry just kind of mentioned. A lot of what I look at is our transport systems and urban space and understanding how we sort of get to where we are now, the history of why streets look the way they do, why we travel the way we do, why cities are designed the way they are. And there were a lot of changes in COVID-19, which I think we're all kind of struggling here as panelists here to talk about. It's very difficult to talk about the positive side of such a terrible pandemic that hurt so many people and affected so many lives. But it is interesting to try to find those little sparks of things where change happened and what that might mean for going forward. And so, as I mentioned, a lot of our urban transport systems are characterized by things that you see on the screen, which are sort of by definition car dependent. It's very difficult or uncomfortable or unpleasant or dangerous even to walk or cycle or use other modes of transport when your landscape looks like this. And even in sort of a slight improvement here, but if you look at just literally the amount of space that's allocated to cars in the roadway for traveling, in the parking lot here, you see, it's about 80% of the space in this sort of image, and most of our cities have about 40% of space is allocated to cars. Again, whether they're moving or whether they're stationary. If you think of all the surface parking lots, all the underground parking lots, there's a ton of space dedicated to cars. And one of the questions that I ask is not only sort of how do we get here, but what can change and what's a better way to think about urban space so people can be healthier, encourage more interactions between people walking around, encourage, again, cleaner air and these kind of things. There's environmental impacts, there's individual and societal health impacts. And these are, in other countries, have solved some of these problems, but it really comes down to how you allocate space. That's the defining, the space in cities is finite, and what we do with that space are political decisions that we can change, we can make them better. And so one of the things, as someone who's been following or thinking about this, researching this for many years, is thinking about the pace at these things. The evidence is very clear that people will cycle if there's more bicycling paths. People will walk more in more, quote unquote, walkable neighborhoods. And so we know this to be true, but there's a lot of pushback from residents, from merchants who are, concerned about parking, for example, who are concerned about free flow traffic. That really still sort of defines a lot of the decision making and processes that happen at municipal and even sort of larger governments. And so one of these, as I say, sort of in some ways it's problematic to use this language, but one of the sort of amazing things that happened during COVID was really almost overnight, this discussion completely changed to not kind of like, okay, we can never do that. We can never put in more bike paths. We can never take away parking, until just kind of, okay, where can we do this? Like, we need more space for people to walk around, because people are encouraged to not travel long distances, because this idea of physical distancing when you're walking around, we kind of acknowledge that we need more space, we need more literal space in our sidewalks and for people to be able to walk around without being within 2 meters of one another. And so what you now see on the screen is another way that we could allocate space in cities. So very different than we saw on the previous slides. So anything from like shutting down roads to car traffic in order to put in bicycle paths or places that people can walk without having to compete with automobiles, or just extending the sort of terraces that we have here in Montreal. And these images are from 3 cities that I'm studying right now, Toronto, Montreal, and Vancouver. And we're trying to study what are these kind of long, sort of medium and long-term effects. We saw these big changes, in 2020, but what we're trying to figure out is how that's changed sort of at the planning level of what the conception is of sort of who should have access to urban space, and how we can make better decisions about how that space is allocated. So here are some kind of images of what that looks like. And this is what Montreal did in terms of they planned. They didn't do exactly what was planned originally, but a very ambitious plan to increase the amount of cycling lanes and pedestrian-only streets and these kind of things. And the good news, I'll end with just sort of a piece of a good news. And so we've done some national representative surveys, and overwhelmingly people support these things. They support there being more of this infrastructure for active transport, so for walking and cycling. As you can see here, the vast majority of people either like the amount that happened, or in fact want more. So that there's very little opposition to these kind of street reallocation problems or projects. And so here's the satisfaction, and here's the support towards doing to maintaining or doing more of these things. And you can see this. I won't be testing you on these figures here, but the main takeaway is that there's a lot of support for these things, and there's very little opposition to having fewer of these types of interventions in our urban spaces. And then finally, my last slide here, just to the sort of what we don't know is also really fascinating here. We don't know what's going to happen with COVID in relation to my own kind of field of research in terms of what this means for future travel demand, what it means for residential location. There's some indication that some people might live farther away from downtown, which has some unfortunate negative environmental impacts in terms of increased travel. But the idea is kind of people maybe won't be traveling as much, commuting every day. If they're only traveling once or twice a week, maybe that's sort of balances out. And also this idea of again, from this idea of sort of who has access to equitable urban space in order to walk and cycle, which has these health outcomes, which has these environmental outcomes, which has these things as a society that everybody wants. And also finally, the other unknown is kind of what it means for our downtowns. Are they going to become less lively if people aren't? What's it going to mean for rents? What's it going to mean for commercial real estate? So these are the kind of things that I'm thinking about a lot, and I encourage you all to think about too as you go on. And I believe that's my time, so I will stop it there. Thanks a lot.
Well, great start, especially as we see Montreal greening and being more friendly to walkers and cyclists. Our next speaker is Professor Hirose, who's a professor and Canada Research Chair in the Department of Philosophy, and also with an appointment at the Baylor School of Environment. Welcome.
So I'm a philosopher, so my presentation will be very abstract, not surprisingly. But today I want to address one very simple issue, that the pandemic showed the importance of two things. One is indirect effects of the pandemic disease, and B, how we balance the indirect effects with direct effects. And then let me explain and spell it out. Okay, so the pandemic, COVID-19 pandemic, brought all sorts of effects. Here's an example. So bad effects, there's a direct bad effect from the pandemic. That is, the pandemic disease killed many people directly. So that's a really direct bad effects. There's indirect effects, such as our pandemic response, such as curfews, lockdown, school closure, social distancing, create economic recession, for example. Okay? And then pandemic response also increases the cases of domestic violence, mental health, social isolation, when those heavy-handed measures are implemented for extended period. Surprisingly, and I don't know if this is an appropriate thing to say, but there was a good effect from the pandemic response. For example, our pandemic response reduced the number of deaths from pneumonia, especially in nursing homes, and then, for example, traffic accident, deaths from traffic accident. So this is meant to be a, positive aspect we got from our pandemic response. So how do we balance these good and bad effects? And then what is the right course of action? What is the right kind of combination of reactions? We don't want to do too much, but we want to do just right amount of public interventions. So idea which I want to point to is the technical notion of excess mortality or excess deaths in public health. So this idea of excess mortality is defined as an increase in the number of deaths above what is normally expected. Okay, so we know actual number of deaths, and then, okay, we have a thought experiment. If the pandemic hadn't happened, how many people could have died during this pandemic period? And then if you see the difference, then that's the size of effects, all things considered. So good effects, bad effects, direct effects, indirect effects, all things considered, okay, how many deaths are attributed to the pandemic disease? Okay, so that kind of idea. Now, surprisingly, there are some countries where there was no excess mortality, such as Japan. There's tens of thousands of people died due to the COVID-19, but actually there were positive aspects, as I said earlier, of the pandemic measure. So that kind of positive effects offset the direct bad effects of pandemic. So there was no extra deaths during pandemic periods. In contrast, for example, in Mexico, the excess mortality is believed to be twice as large as the reported number of COVID-19 deaths. There are multiple reasons for that. Probably one reason is that probably in Mexico, they didn't check all the dead people, whether they had the virus or not. Okay, so that kind of technical problem. Second is that probably they did lots of lockdown and restrictions, and then that probably deprived lots of economic activities, and then some poor people died prematurely or something like that. So we don't know. There are all sorts of reasons, but if we look at the population size, which is very easy to calculate, then you can see the difference, and then you can estimate the extent of the good and bad effects, net effects of pandemic, and then our pandemic response. Now, this issue so our focus on excess mortality in the context of pandemic can give us some good idea about how we approach or how we think about climate change, for example. Okay, so So I need to finish now. So, what could climate change do is that the climate change kill people, but how many people will be killed by climate change? We can see the difference between actual global population and then the number of population that could be expected if climate change did not happen. And if you see the difference, then that's the number of victims of climate change. But in hurricane, will kill many people each year, even if climate change doesn't happen. But climate change increases the frequency and the severity of hurricane, which kill extra people. So the difference, so the extra people who die, it's a number of victims of climate change. So it's like it's a climate, so it's really hard. We cannot pin down this Mr. Johnson is a victim of climate change. We can only know from the difference in the statistical data. So the problem of that is that the last bit, number 3, is that not many people have sympathy to the statistical victims, excess mortalities, number of victims which we can capture from data. Whereas we have a strong sympathy and empathy towards people, identified victims whose face and name can be identified, right? So that's why whenever we talk about environment, we care about environment, we must do something, but actually we care less about future generations because they are statistical peoples. People, big victim of climate change is statistical numbers, okay? Whereas we care more about people who are suffering now around you. So we have this kind of bias, and this bias, cognitive, legal, and moral bias towards identified victims, makes our policy towards climate change even more difficult. Okay, so that's what I wanted to say. Thank you very much.
Thanks very much for that interesting assessment of direct and indirect effects. We typically associate those who are trained in the deathly sciences talking about mortality, but I think in the context of climate change, thinking about the direct and indirect effects and long-term, very important. Thank you. So we're going to move now to our third presenter, who's Professor Jill Baumgartner, and she's a professor in the Department of Epidemiology, Biostatistics, and Occupational Health in the School of Population and Global Health, and also a member of the Department of Equity, Ethics, and Policy, otherwise known as DEEP. So Jill, welcome.
Thanks. I just put School of Population and Global Health for simplicity, since I do belong to a number of different places. But I'm going to be talking about how we think about working with the environment to protect populations and things that we've learned from the pandemic, or that I hope that we've learned from the pandemic. I wanted to start with this map. This is from 2017. This is by a small unknown researcher named Anthony Fauci, who put this together and basically said, look, these are emerging diseases. They're newly emerging. They are re-emerging diseases. They're happening all over the world. We need to keep our eyes open because things like H1N1, SARS, Napa virus, these are happening at increasingly large scales. We've got to be on it. So we all know what happened. But I wanted to talk about how that relates to environmental conditions, because the pandemic clearly happened, and environment actually relates to that in ways that I think we don't often account for. So things like air pollution. Air pollution is something that I study. We know that air pollution increases your susceptibility for infection, but also the severity of infection from respiratory viruses like COVID. We know that things like urban expansion and land use change, these are things that change the way that people interact with animals in an environment. That's also associated with an increased risk of infectious diseases. We learned during the pandemic that the air in the room that we're in, right, and the ventilation that's in that room and the infrastructure is actually really important for protecting ourselves. Water and sanitation and access to that. COVID was spreading through sanitation systems. That's the case for a lot of other infectious diseases. So this link between environment and infectious diseases is there. This is not something new. We've known about this for many, many years. When I was a graduate student, which was actually about 20 years ago at this point, this was a topic that we were talking about, right? That this was an issue. We needed to think about the way that the environment impacted health. I don't think that really came to fruition with regards to policy and change, but I do think that the pandemic has changed the way that we think about our relationship with the environment. So I just want to talk about 3 ways that I think there's been some positive change. So the first is that I think we all know now that society is actually really well equipped for change today. Not tomorrow, not next year, but we have the tools and resources to make change. And I think Dr. Manaugh's talk did a really nice job of covering some of those, right? We didn't envision that you could change cities in the way that we did. But once we saw that happening, this became a real possibility, right? We can change cities and we can do that quickly. We have technologies in place to reduce traffic, emissions, industry emissions, right? These exist. And we saw this during the pandemic, right? Cities had a 50% reduction in NO2. That's a pollutant that's emitted from cars. So these things exist, they're there, they're accessible. We have to make use of these existing solutions. The second thing is that there is this really renewed interest, and maybe beyond interest, but necessity for environmental stewardship. So I don't know about you, but I had friends that were self-proclaimed like allergic to camping or being outside, and they were like the first ones during the pandemic heading to like their tents to get outside and go camping and hiking and things like that. And this is a really good thing. People were getting out into nature. They wanted to have the opportunity to sort of be in a new place, be outside. And that's good. That gives us a sense of, wow, nature's great. We want to keep it around. We see this in our undergrads at McGill. There's a demand for addressing climate change, and so I think we really need to leverage that. And then the third thing is this increased attention to equity. I included this quote here by Beverly Wright, who's at the Deep South Center for Environmental Justice in the United States. I'll just summarize the fact that she was saying, look, there were all of these people that were saying, we've not long known that the emissions coming from these facilities, this is industrial facilities, are dangerous for the health of people that live nearby them. And it's Black people who live the closest. We've known this for a long time. It is results of segregation, racist policies, and they put people of color, racialized populations close to areas that are more polluted. So I'm tired of being told that our COVID death rates are only because we're obese or have diabetes or eating badly, without regard to the systemic harm pollution has caused us, right? Thinking about not environmental risk, but environmental racism, right? What are the drivers of people's exposure to environmental pollution and environmental change? Who's the most impacted, but also who's at the decision-making table, right? As we're thinking about who's making decisions, are they the same people that are experiencing these impacts? In some cases, yes, but certainly in the vast majority of cases, that was no. So just moving forward, and I'll wrap up here. During pandemics, we obviously need to respond to emergencies, right? We need to do this quickly, and we need to do this with determination, and I think we saw this happening during the pandemic. But I think the really question for all of us is whether or not we can leverage what we've learned during this pandemic and address some of these underlying problems of climate change, but also environmental change, with the tools and resources that we have right now, but also thinking about that towards the future. Thank you.
Thanks, Jill, and thanks so much for bringing up the issue of equity and recognizing that the indirect and direct benefits were not equally distributed, and I think that's really important for us to keep in mind. Our final speaker, before we get into Q&A, is Professor Jason Harley. He's an associate professor of surgery. Jason, welcome.
Thanks so much. As an alumni myself, it's a special privilege to be here and talk with you today. So I'm going to be talking about it from yet another different perspective, which I think is fun. It gives us a lot of ways of thinking about this. Specifically, healthcare professional burnout during the pandemic, which we've heard lots about. And just like our last talk, this wasn't a new issue. But as was just mentioned by my colleague, we really do need to do something about it today, not tomorrow. 2020 headlines were pretty grim for lots of reasons. Many of you probably saw headlines like this: suicides, burnout, quitting, etc. Those headlines haven't entirely gone away. As we can see, this was just a couple of days ago, pointing to crowded and a healthcare system that continues to be stretched far too thin, resulting in an exhausted workforce at all levels. And as a result, challenges to our care. During around 2020, a number of colleagues, medical doctors, nurses, and others, and myself worked together to look at and try to assess how our healthcare professionals were doing in Quebec and in Montreal. We'd read a number of studies that were coming out of China, out of Europe, as COVID moved closer and closer and closer, and we wanted to see how they were doing. The answer was, as you can tell from some of the headlines I'm showing from some of the media that we did, was not good, unfortunately. And the study we did proved also, unfortunately, to be quite accurate in predicting some of the challenges that our healthcare workers were facing and would continue to face. So as I mentioned, we knew from decades of previous studies that the situation with regards to burnout amongst healthcare professionals was bad and not getting better. It was going the wrong way. We saw, again, from our study that despite this, we found statistically significantly higher levels of stress and different forms of psychological distress when we asked healthcare professionals in our sample to compare how they felt then versus before the pandemic. We found that people who use more adaptive coping strategies were buffered against the effects of stress and burnout, including turnover intentions. And so that was great, but we also need to do more than simply download these responsibilities to healthcare professionals. So adaptive coping is good, but we also need to look more holistically at this. And I think my slide jumped. Yes, it did. So I'll go back up. We also found, and I think one of the most interesting results we had, was that just because support was available to healthcare workers didn't mean that they were aware of it. And beyond that, even when support was available, for example, counseling, that didn't mean it was being used. And interestingly, in some cases, it might be endorsed. People might say, oh yeah, this is important. People should use it. But are you? Nah. And this was, again, from our sample, pointing at some important questions we need to ask ourselves in hospitals and universities and other areas when we're providing different types of supports for our healthcare professionals. Is it what they want? Is it being targeted effectively to them? Do they know about it? And are they buying in? Not just as it being a good idea, but something that they think can help them. Very briefly, again, with regards to this issue being important, this has downstream consequences with regards to retaining our healthcare workers, as we've heard. And one of the stats that caught a lot of attention was that 1 in 5 of our physicians expressed an intention to quit, but about half of our nursing staff. So this really heralded issues. What we're doing right now at McGill and at the McGill University Health Center is trying to focus on some things we can do to prepare our future healthcare workers to face some of the very challenging professional landscape that they're in. And simulation plays a particularly important role. One of the things we're doing is focusing on better understanding and better training healthcare professionals so they can be more emotionally intelligent, have more control over their emotions and psychological well-being, and also help support those colleagues of theirs. This is a relatively new area of research to be in, and so we're looking at this from a number of different perspectives, both scientific and practical. We're looking at leveraging psychophysiological data so that we can understand how, for example, stress can be contagious in a social situation from one person to others, and what that looks like. And then importantly, how during what's called a debriefing phase of a simulation, where people talk after they've had a chance to practice doing something, what went wrong, what went right. And knowing these sorts of pieces of information can really enrich those educational experiences and equip people with the tools they need to be better colleagues. Towards that end, collegiality in healthcare has also unfortunately been a challenge. This is related to burnout, certainly harassment, mistreatment. These things contribute to burnout, to quitting, and we simply cannot afford to lose healthcare workers and to lose other allied health professions. So we're also doing work specifically targeting improving people's understandings of what mistreatment, what harassment looks like, but most importantly, what are some concrete skills and strategies that people can do about it to be a good colleague? So we're giving them this theoretical or conceptual knowledge, and then we're giving them practice, once again in a simulation, because very much I believe simulation is really key to what we're doing, giving people hands-on practice, applying what they've been learning about. It's the same thing for this. So while they're engaged in this case, a chest tube insertion, we have them practice intervening in a situation where a series of actors are, in this case, a senior resident is harassing a medical student, and it's an opportunity for them to practice intervening. I'm going to stop right there. I am under 5 minutes, lots of practicing there. I'd be happy to take any questions while we're up here and elaborate on any of these studies. Thanks so much.
So a big round of applause, not only for Jason, but all of our presenters who were remarkably on time and to point. And so we now have the opportunity to invite them up and face, what do we call it, the Shark Tank? This is when it gets things. So please let me know if you'd like to start with a question. We'll jump right in. And remember that multiple choice test is coming. So please, and if you could just introduce yourself, that'd be great. Thanks.
Dave Blank, Director Emeritus of the Entrepreneurial Program at McGill. It's clear what we need. Could I get your feeling as to whether or not those necessary changes can effectively be handled by, quote unquote, the market, or is it going to have to be imposed by government policy?
Great. Market or government? That's a binary choice. It might be some hybrid in some circles. So, who would like to start?
What we saw at the beginning, there was, again, a lot of collective will. People were thinking again, thinking about things as a collective, and they were motivated to do so. But not everyone, and certainly there were multiple examples of that. The convoy was just one of them. I think that when there are government mandates, I think this can act as what I like to call a motivational safety net, because trying to get everyone on board on the same topic, to what we call in psychology to intrinsically motivate people, for example, to have them understand and act and be on board with something is a huge challenge with an enormous population of very different people with different understandings and different attitudes and different beliefs and et cetera, et cetera, et cetera. So from my perspective, I think that it is helpful if our goal is really to have something as widespread as possible, that it seems that we do need at least some, we do need the government to have some policies in place so that we can have what we refer, once again, as extrinsic motivation as well. So the people who might not respond to doing something for others, who can choose to pay attention to news outlets or no news outlets and just difficult uncles' social media feeds, for example, that we can kind of collect everyone. Hope that helps. That's just my perspective.
Great. Anybody else want to jump in on this? Either Bill, Kevin?
Pass the mic. And you're like, no.
I mean, so I'll talk briefly. I'll save, I suspect there's a possibility we might say similar things. But I mean, so when it comes to things like clean energy, which are one of the main drivers of a lot of the environmental change that is driving some of the adverse health impacts, including not just infectious diseases, but cardiovascular diseases. I mean, improving energy efficiency is almost always cost effective, right? So I think in that way, it's certainly a cost-effective approach for businesses. and that can be encouraged by government programs. So I think that energy seems like, look, we have the technologies, they exist right now, and there's a really good economic argument to be made for investing in those. On the sort of flip side of that, I'll say, I think behavioral change, so as someone, I'm actually married to an economist, and it always used to drive me a little bit crazy because whenever I would talk about individual efforts related to environment, he would just be like, it's really not that important. It's really just, your individual stuff doesn't really matter. It's really, it's these larger scale changes, and I think the pandemic has actually shown us that individual decisions have a big impact. Choose not to eat meat. Get enough people to make that individual decision. That actually has a really big impact, right? The way that we make our food choices is big. The way that we make decisions around heating our home, right, within the city of Montreal. Now, government policies can, provide incentives to us to make that change. We can have improvements in technologies from businesses that are trying to, promote that change as well, but individual decisions actually can play a big role in that as well.
Great. Kevin?
So just to go back to the question, right? So when we're thinking about, in my own field or my own research, my own kind of ways of thinking about these things, looking at urban transport systems, they're clearly not, to some degree, people can make a decision, in a perfect scenario if they have access to a safe place to walk or to cycle or to take transit. But if they don't have those options, if it's not safe to walk around, if it's not safe to cycle, I think sometimes the narrative sort of blames people to say, well, you should give up your car, you should walk more, you should cycle more. But some people just truly don't have that option in terms of where they're living, and that's where where a government has to come in and provide that either transit infrastructure or the cycling lanes or places to walk and cycle or change the land use patterns so you don't have to drive 15 miles to get somewhere. And so there's a balance of once people are given once governments step up and offer people what they need in terms of safe and environmentally friendly transit systems and transport systems in general, then becomes sort of an issue of changing behavior and getting people to understand the impacts of those decisions. But I think something that I've changed even my own thinking in recent years is it's easy to blame people for their choices in terms of their transport choices, but you really need to understand if they don't feel safe or comfortable or it's not convenient to use those modes of transport, that's really a wider societal thing to take care of. It's not up to an individual to do something that they feel that's dangerous or uncomfortable, and it's really up to society to step up and make those choices more better choices.
Wow, did you want to jump in on this as well? Okay.
Yeah, so I think we have to combine both like public intervention and the market or voluntary behavior change. Take example of pandemic response. So like Japan, they didn't take any forceful public interventions. So they didn't close non-essential businesses, bars, restaurants, karaoke, that's all open during the pandemic. But this didn't mean that the Japanese government didn't do anything. So for example, they gave an incentive to close restaurants and bars after, say, 6 o'clock. So if you close, we will give you $300 per day, and then if you can choose, you can take this $300 per day or not. Okay, so, but more than 80% of restaurants and bars in Japan, in Tokyo, closed down during the peak of pandemic period. So this is kind of combination of voluntary behavior. So government intervention which tries to induce behavioral change of small business owners. So they didn't do like heavy-handed lockdown or school closure or curfews, but actually result wasn't worse than, say, Canadian case experience. So we need to combine both of them, I think.
Great. I think we've got both answers in the affirmative, those both options. So remember that for your multiple choice class. All right, I think we had one here. Yeah, and then another one. Okay, please, and introduce yourself.
Yeah, my name is George Sampson. I'm a McGill alumnus. Happy to be here for homecoming. I'm here from Ottawa, the Big Apple of Canada. And my question is a what-if question. Now, SARS happened in 2003, and allegedly COVID was declared in China. I've been to China many, many times, and to Wuhan, for example. irrespective of that, my question is what if? What could society have done, and the medical profession have done at large? What could we have done proactively to have prevented COVID? Thank you.
Great. Who wants to handle that easy question? I see all sorts of people signing up quickly.
Do you want to take this first?
I mean, I'm not a clinician, but so okay. One thing that I think we at least right. Yes, this is on. So I work on air pollution. Like investments in indoor infrastructure seems like really low-hanging fruit to me, and for a couple of reasons. So one is that like if you improve ventilation systems in buildings, like this one, for example, or others around the city of Montreal, which are mostly outdated, and in many of them they have really poor ventilation, that's doing a great service, not only for future pandemics, but also just for the general health of the public, right? We spent 90% of our time indoors, but we actually don't spend that much time investing in the air quality in the indoor environment. We know that kids perform better on school tests when the air quality is better. We know that they specifically perform better in math, right? If you have a better air quality and improved ventilation, we know that it's healthier for, if we think about things like healthy worker studies that have looked at the health of workers in office buildings, better air quality is something that I think we could very easily do, and it would help us not just for just general public health, but also in preparation for another pandemic.
Great. Thanks, Jill. And Jason?
Okay, I've got the
You've
mic.
got the mic.
Again, no magic fix, no silver bullet, no hindsight 2020. But one thing that that struck me at the beginning was that there was some, it was a lot of adjustment for the general public, for everyone to make in all spheres. But one thing that I recall being a little bit of a slower transition was to mask wearing. And that's something that we see that in other parts of the world is more ingrained in terms of culture. If you're sick, you wear a mask. It's a polite thing to do. But that's not something that we've seen generally in North American and other Western cultures. And so I think this created, there was some, if I recall correctly, some confusion, and that was slower than some of the other measures to unfold. So if I could go back in time, and as a science fiction fan, I'm all here for that sort of thing. Maybe not as much as a scientist. That would be maybe one thing that I think that we could approach differently. But it was for sure a very challenging thing to adapt to.
Thanks. Wow.
In 2006, just after the SARS outbreak, so I served on the ethics committee in WHO ethics committee for ethical guidelines for pandemic preparedness and that kind of stuff. So I asked lots of public health doctors in WHO in 2006, why didn't the SARS become epidemic or pandemic? Why was international but still outbreak? And then they said, nobody knows, only God knows. So there are so many things we don't know why this COVID-19 became pandemic rather than epidemic in Wuhan city. So we don't really know. Now, there's uncertainty like this. Now, if we detect similar case somewhere, I don't know, China or Mexico or whatever next time, what shall we do? So even though we don't know this becomes pandemic or epidemic or local outbreak, should we close the border? Should we do something? So this is really difficult question simply because we don't have much information, right? So the answer is that nobody really knows the right answer to you, but there's some kind of things we might do or not do in the next event, I think.
I think, as some people have said, the next pandemic never looks like the last pandemic, which is a humbling adage. We have a question at the back, and then I have a question here and here. So we'll try and get these in. We've got about another 10 minutes, I think. Please.
My name is Ashley Hilliard. I'm 72 grad, or used to be kind of here. I'm interested in kind of the ability of, whether any of you have thought of the ability of how you motivate people to persevere. noticed when I flew out here on the airplane, not many people were wearing a mask. We're talking about COVID in an enclosed space, and we know that it's I'm not blaming anyone, but I'm just noticing that people have relaxed a little bit about it. It's hard to sustain effort over a long period of time. Certainly in open societies, they can perhaps impose it in China, but we'll see how that works out for them in the long run. So, longer term, not just thinking about COVID, just thinking about the bigger problem that we face, namely the breakdown of our climate. How does one, have you people thought and seen what can one do that will sustain the effort that will be necessary to do the changes that we all think that?
Great. Thank you. Well, it's a good thing is you're talking to a very young panel, so they've got lots of time to sustain change. So, who wants to jump in on this? Kevin, do you want to?
I can say something. So great question. All the questions have been great. You know, I think one of the things that I appreciated hearing about, at least partway through the pandemic, was, you know, there being a clear line that people in healthcare and politicians were trying to draw with regards to why we were doing things and reminding the public why it was important to get vaccinated, why public health measures were in place, and that it wasn't an encouraging, again, people not just to think of, you know, themselves. You know, some people would think, oh, well, I'm in a certain age bracket, I'm not concerned, you know, whatever. But by encouraging people to remember that they're, you know, they're getting vaccinated, they're participating or complying with public health measures, that this is not only for them, it's for their loved ones, it's for also those who are more vulnerable, and in turn, you know, it's going to sustain the healthcare system. And thinking about it, to motivate people, we want to both make people think of, to go outside of thinking just about themselves so that they can better understand how something can impact others, but we also do want to connect it back to them. And one of the ways of doing that was to remind people that there's only so many beds in a hospital. And if the healthcare system is overwhelmed, for, you know, as it has been, then if you have a car accident, if you have a heart attack, you're not going to have the level of care that you would like to have. So bringing it back down to the individual, but again, and helping them to see how it can impact others, I think are two important strategies, and I was happy to see more of this, you know, in play.
I'll just quickly add to that, which is that I'll plug the McGill undergrads. So they have a lot of energy, and I think they're reflective of that generation, and they are pushing, as I appreciate that we're young. We're not that young, but they push us, right? So they push us to bring climate change, equity into our curriculum and into our agenda. It's part of the questions that we're asking. Like, they are shifting in real time, I think, the way that we do research and the way that higher education is being pursued. So I think that is going to be, you know, it's happening throughout not just academia, but throughout society. And so I think that has really been a driver for sort of sustaining, you're talking about environment, like how do we sustain these practices in the environment? And I think you have a generation that is pushing really hard for that, and they're holding us accountable.
And I'll just add, I mean, I think that your question kind of ties the first three questions together in some ways in terms of, you know, what could have been different. We saw in this country, I mean, in my country of birth, the U.S., I mean, we saw there was so much resistance to masking in ways that just absolutely baffled me, and you know, to this day. And you know, but I think this idea that I don't think we have the answer up here or, you know, in the audience, but how can we make these messages that are clear that, you know, that your actions are impacting, you know, the people that you do know and love, and also people that you will never meet, which also ties into Yuao's really important point about the idea of kind of a statistical life versus a, you know, a person you can put a name and a face to. But I would hope, in my hopeful, optimistic thinking, you know, that this idea of being able to frame these issues as you know, doing something that's, you know, not only good for yourself, but good for other people on the planet. Whether it's a pandemic, whether it's climate change, would be a way to sort of get into the hearts and minds of people to make behavior change, or to I think, as you said, to kind of continue that behavior for the long run, because there's a lot of things we do need to change, and there's a lot of support for that, and there's a lot of reasons to do that. So I hope we can get our act together to move forward.
Thanks. Okay, so we have right over here and then in the front. And have I missed anybody? We'll take these as the last two because I think we're getting close to our time. Please.
Really honestly, so I'm a first-year undergraduate student.
Awesome.
So my question is, most school health experts, acknowledge that an oncoming pandemic of any type of infectious diseases in the future. Do you believe that COVID-19 has impacted public policy, like North America, even internationally, to kind of shift governments to start focusing on that potential future pandemic in regards to environmental policy, social policy, urban planning?
Great question. What do people think? Yes or no? Yeah.
So I don't know about future, but already Canada has changed quite a lot after the experience of SARS outbreak in 2003, 4, 5, around there. Because Canada, to be honest, well, more specifically Ontario, wasn't prepared at all for that. There was no ethics guideline, there's no rationing problem. That's why Canada, actually, University of Toronto Medical School took a lead to create one of the first ethical guidelines during the pandemic or response to scarce resources in the healthcare setting. So actually, Canada had a bad experience and learned a lot of things, and then actually leading in this kind of ethical guidelines for pandemic. So I think Canada did actually, I don't know, good. I didn't say well, but not actually better than many other countries. So I think Canada had a really positive experience from before, and I'm pretty sure Canada will have even better experience in future.
Great. Anybody else want to?
I'll just make this really quick, because I think the people to my right probably have more to say. But I mean, I think on a very sort of concrete level, in terms of the sort of urban planning perspective, I think there is. And we've got a project with some colleagues to study this for the next 4 or 5 years, to see what are these kind of medium and long-term impacts. Is this going to change the way, as I already mentioned in my talk, but is this going to change the way we think about urban space? Is it going to change the way we think about transport networks, which has impacts, these kind of dual issues we're talking about. This is supposed to be about COVID, but we're talking a lot about just climate change and environment in general. But these could have huge impacts on environmental outcomes, but then also on the spread of pandemic diseases. If there is, the whole point of a lot of these interventions was to give people more space, so people weren't as in crowded spaces as much. So we'll see kind of if that's a long-term thing, or if planners and politicians kind of go back to status quo.
Great. Okay.
Yeah, I mean, I think you got at the end there, like what we haven't been talking about a lot is on leadership. And I think on a lot of these issues, there's been a lack of leadership. And I won't get into, I mean, we see this politically, we see this across various sectors, and I think it's a question of if that's going to change. I think there's a lot of demand for change. I think when you see real leadership, that does happen, but it's a question of whether or not that's going to continue.
Great points from everyone. There has been some great leadership within our hospitals and within our healthcare systems. So there was an immense amount of work that went into creating new protocols so that hospitals could function, that they could treat patients, that they could triage, prioritize. And so I think that work that's done, of course, depending on what comes next, we can adapt, but I think that a lot of that work is going to be helpful moving forward. Second, to bring it back to the specific issues that I was talking about, healthcare worker well-being and retention has really been flagged as an issue by our Royal College of Physicians and Surgeons of Canada, for example, which is one of our major medical accreditation bodies in Canada, and it's similar down south as well in the U.S. And so these are, it's really important when local and also national and international leaders identify things that are in a crisis stage, and there are lots of things in crisis right now, as priorities, because that's an important part of signaling that change has to happen, not tomorrow, but today, which is, I think, a nice theme for today.
Great, thanks. And here for our final question, please.
I am quite interested in your parallel, well, certainly with the environment. We're going to have lots more pandemics, but I think environmental mitigation is really important for that. But with your government mandates, and in British Columbia, we did fine until the vaccine mandates came in. And that's where we got a lot of opposition from certain parts of the public, and we got a lot of crazy, you know, all the crazy stuff that went around. And it was really difficult then, and we lost, actually, we have healthcare workers who don't believe in vaccine, who were scared of it and didn't want it. And so that was a problem in the hospital. We were losing people. And Bonnie Henry originally said there'd be no vaccine mandate. And I mean, I work in infection control. I really want a vaccine mandate. And you know, if you're a person coming to the hospital, you want the healthcare providers vaccinated. But it was just a very, that's where, to me, the opposition happened. The masking, I mean, you know, when that was mandated, that we didn't get the opposition, and that's, I mean, what just sparked the Ottawa protest. And so I'm interested in that, and hope we don't go too far with government mandates with climate change, because you can get the reaction from them.
Thanks for that comment, but could you just introduce yourself, please, for us?
I'm sorry. My name's Joan Tomlin, and I'm a medical school alumnus from 1972, and I'm a medical microbiologist in British Columbia.
Great. Thanks, John. Anybody want to comment on that comment?
Sure. I know that in branches of the federal government that media literacy has become, you know, a recent priority, as it should. There's a lot of work we need to do educationally, not just really at the university level and at the public level, but also, you know, K to 12. So to help equip people with the tools to be able to, again, think critically, and to develop those reflexes, because that's really what they are ultimately. If we all know, many of us know how to do something, but if we get caught up, for example, in our emotional responses, which is what is hoped for in a lot of the false news, fake news, it has many names, those are issues. So I think those are priorities, and hopefully also there'll be more work done with regards to our social media and social networks to better identify, fake information, and to again prevent that from spreading. Because I think that there's a role that the private sector has to play collaboratively, with government and research, etc.
Great. Okay. Any other comments on this?
Just quickly, I'm really intrigued by by the question or by the comment, and I think it goes back to the first gentleman's point about the role of sort of top-down decision making or these mandates in terms of and saying that there was only protest or there was only backlash against it when it became not just a personal choice, but it became something that you by law have no choice in. And so I guess maybe slightly paraphrasing or slightly if you can imagine a world where everyone knows what to do and does that and doesn't require governmental mandates, maybe that's the world we want to live in. But it goes again that the common theme here is how do we get there? How do we get, as Jason's point, is that an education question? Is that just make sure more people trust the science and trust science in general, and aren't gonna have these irrational backlashes against very well-meaning people who are trying to help, whether that's a pandemic, whether that's clear issue of climate change, for example.
We need government mandates, just not too far. I think that they make things happen a lot faster.
So we have one supplemental here. We're into overtime, so everybody gets paid double. McGill policy.
Professor Baumgartner, you mentioned sort of the throwaway line, advanced education. I wish that we had as fifth member of the panel, or at least somebody in the audience, who was in the McGill Department of Education, to see how all of the brilliance that you have shown can be translated not just at the senior levels, but starting in grammar school. Thanks.
So great comment, and I think you're getting nodding heads everywhere, which is great. So listen, I'm just going to bring out my PowerPoints now. It's just 60 short ones. It's good to have a rest after such an exciting panel. No, just a few comments to summarize. First, an anecdote. In October 2019, I was at a tabletop simulation, Jason, a simulation of a novel coronavirus that was breaking out in Southeast Asia. And the simulation went 4 rounds over 4 hours with 12 people around the table who were supposed to be acting as a global pandemic board. I was one of the invitees. After the 4 rounds of simulation where the pandemic got progressively worse and it shut down the economy and created all sorts of the things that we've seen in the real pandemic, we were asked to evaluate our performance, as you do in simulations, debrief and learn. And we had rare consensus, which is that none of us around the table felt we were anywhere close to prepared for the real thing. Now, unlike what you might hear on certain media, none of us at that table had any idea that the real pandemic was actually brewing at that time, and 1 month later we had the first cases in Wuhan. But I think it speaks to this issue that the future is uncertain, but it is a dangerous future, that's fair to say. But I'd like to pick up on one of the, I think, behaviors that was exemplified in our panel was the humility expressed and the importance of learning and shying away from a hubris which suggests we know, because often in times of uncertainty, hubris takes over inappropriately. Second point I'd like to say is that the future is upon us now, and I think sustainability is going to require us not to simply say we have to sustain, but we have to actually accelerate, because the rate of change is also increasing, and increasing in multiple domains at the same time. And so I think the behavior that we have to generate through our education systems is one of accelerated production of ingenuity, which is going to allow us to collectively solve problems more effectively than perhaps we have in the past, if we're going to be effective in the future. Third thing I'd like to say is that there is no one-size-fits-all solution. We will never have a global government. The WHO, which the mayor of Toronto in 2003, his name was Mel Lastman, for those of you who remember, and when WHO imposed travel sanctions on Toronto because of the SARS outbreak, Mel Lastman said, "Who is WHO?" And in fact, now I think most Canadians, and even mayors of Toronto, know that there's a World Health Organization, and it plays an important role, but it's not going to solve all our problems. And in that regard, I'd just like to finish by saying my own assessment of Canada's performance in the pandemic is that our most valuable resource has been our population. People across the country have been incredibly sage and well-behaved and using common sense to do the right thing. And when you compare our collective behavior, just for example, to our neighbors of the South, you just see what an incredibly rich national asset we have. So I think that's particularly important, but I also like our panelists who recognize that education, and our audience who say education of that next generation. We do have to look to undergrads who come in hungry with a sense of what the future not only holds, but what role they'd like to play in it. And I'm impressed today with the faculty here that have been assembled to engage and spark this collection. The alumni here who are giving us pearls of wisdom from lived experience from your various perspectives. And so I'm hoping that we can move on from this session a little bit more enlightened, humble, but very determined to take action now. Thank you all.